Hi, I'm Supriya.
Hi, I'm Dr. Zakia, interventional cardiologist here.
So it's always very nice to meet you on any of the day and discuss various patient issues that you face commonly on a day-to-day basis. Today I thought I will discuss with you on myths which are very common amongst the people and myths related to various cardiac ailments. So, are you okay with that, Dr. Zakia?
Sure, that will be very nice.
So first myth that is very prevalent on BP or blood pressure, hypertension is patient says अगर मुझे BP है और अगर मैंने मेडिसिन ले ली, ड्रग ले लिया और अगर BP कंट्रोल में आ रही है, BP the blood pressure is getting under controlled, I can stop my medicine. So what's the fact on that?
Actually, BP is one of the biggest killers. Almost 40 to 50% heart disease and brain strokes are caused by uncontrolled blood pressure. And BP is a disease which happens because of aging of the arteries. So it's not caused by any germs that I can give antibiotic and the course will go away and then we'll stop the drugs. We can only control blood pressure, so we need to give medications as per the decision of the doctor for life.
Okay.
The BP medications can't be stopped. So as a cardiologist, I take time to diagnose a patient of high blood pressure. So I will maybe give him ambulatory BP monitoring, or I ask him to do home BP monitoring with digital instrument.
Right.
Be very sure that he has high blood pressure over a period of maybe 4 to 6 weeks. And then start him on treatment. Once I start him on treatment, the treatment is going to be lifelong.
Okay.
So we must bust this myth that once the BP is controlled and I'm feeling fine, BP medication can be stopped. No. In fact, it is one of the biggest silent killer. Your blood pressure can be 210 by 120, still you may not have any symptoms.
Right.
So you need to take the treatment as your cardiologist advice.
Right. I think that was very important for patients to get a message that blood pressure can be controlled with a lifelong treatment and cannot be stopped once the blood pressure is under control. So Dr. Zakia will go to the next myth again. This is on the heart attack. So the heart attack, they are commonly, the myth is मैं तो अभी जवान हूँ, I'm very young at age, I will not get a heart attack. और हार्ट अटैक्स तो आते हैं तो कॉमनली सीन इन एल्डरली. सो दिस इज अ मिथ अराउंड. वी वांट टू नो व्हाट्स अ फैक्ट ऑन heart attacks in young age.
See, in fact, this is the story of India actually. Okay, Indian patient is 10 years younger than the Western counterpart. So हमारे में heart disease 10 साल पहले आती है.
Oh.
My youngest patient was 18-year-old.
Oh, that's really
and
quite young.
He had a massive heart attack and we had to really treat him in time. So Supriya, it's not the age or the gender. It is important that you recognize symptoms.
Correct.
So if you have a chest discomfort which makes you restless, sweat and maybe even vomit at an odd hour of the day, please seek help from your closest good hospital where all the treatment facilities are available.
Correct.
To diagnose heart attack in time and treat in time. Remember, Supriya, that in heart attack we say time is muscle.
Absolutely.
That means if you delay coming to the hospital by 4 to 6 hours, in my personal experience, what I see is that patients, when they get chest discomfort, they feel that it's gas. Then they will take Gelusil, then they will drink soda,
Right.
Then they'll go to their family doctor, and then they will waste a lot of time in seeking multiple opinions. By the time they reach the hospital, it could be late. Remember, we have only 6 hours to save a heart from permanent damage.
Correct.
And the first 2 hours are the most important. We say the first hour is the golden hour.
Right.
Because maximum deaths from heart attack occur in the first hour. So if you are not in a right place when you have that heart attack, you could lose your life.
Right.
And if you delay the treatment, you could damage your heart permanently. So remember, age is not a bar, sex is not a bar.
Correct.
Anybody can get heart attack at any age, and especially now following COVID.
Thank you, Madam. You actually elaborated quite a bit on heart attacks in young, and I'm going to continue with the myth on heart attack again. The another myth which is very common and very popular is अगर मुझे हार्ट अटैक हो जाती है और मैं अगर हॉस्पिटल जाता हूँ और जाती हूँ तो डॉक्टर तो मुझे स्टेंट लगा ही देंगे. That's again a common myth.
So for that we must understand why heart attack happens, how it happens.
Correct.
So heart attack happens because a blood vessel supplying blood to your heart gets completely occluded. That means there is no blood supply, zero blood supply going to that particular area of the heart.
Right.
So there is an ongoing heart damage when the heart attack happens. And as I told you that we have very little time to save that heart.
Right.
Maximum 6 hours, best possible first 2 hours, we say 90 minutes.
Right.
90 minutes is by all international guidelines that you must restore blood supply in these hearts.
Correct.
If you can't do that, the patient's heart is going to be permanently damaged.
Oh.
So this patient's treatment, the primary angioplasty, what we say, is the best treatment recognized to save lives and save hearts all over the world. So the best recommended treatment for heart attack is angioplasty.
Okay.
So the moment the patient comes to us, we quickly prepare the patient, take the patient to the cath lab and open the artery and completely restore the blood supply.
Right.
So the faster you do it, the better it is for the patient, and the outcomes, long-term morbidity, mortality, saving of lives is better.
Absolutely.
So the heart attack angioplasty is unlike other angioplasties.
Okay.
In a routine angioplasty, you could have time. You could take opinion from a doctor when you don't have a heart attack.
Right.
But in heart attack, you don't have time. If you waste time, you are playing with the life of patient and playing with his heart.
Correct.
Which is going to be permanently damaged if you don't treat in time.
Correct.
So it is important that when a doctor tells you that this angioplasty is life-saving, please listen to your doctor and give consent for it.
Right.
I'd be very happy with my patients if they are educated and understand what we are talking and listen to doctor and have faith in your doctor.
Correct. I think the important point here to highlight was doing a plasty when it is a heart attack versus planning a angioplasty on a silent heart. I think those two are important points for us to mention here. And yeah, so I think the golden hour extremely plays an important role when it is an acute heart attack.